Hi, I'm Dr. Tina Marcantel, and today I'm going to talk to you guys about perimenopause. We're going to talk about what is perimenopause, and we're also going to talk about what is going on physiologically during perimenopause. In other words, what are some of the changes that are going along with our body. The other thing we're going to talk about are the signs and symptoms of perimenopause. And the last thing we're going to talk about is what can we do about these signs and symptoms during perimenopause. All right, so what is perimenopause? Perimenopause are the years before menopause. It could be lasting 2 years. It could be lasting 5 years, 10 years. Some people are even starting perimenopause in their 30s. It depends on genetics. It depends on the estrogen environment, because there are estrogens in cosmetics, in plastics, and all kind of things that can affect the time that you start perimenopause. And we'll go into that a little bit more into detail. So number two, what is happening on a physiological level? What are the changes going on with our body? We are going into decreasing ovulation. So what that means is there's actually a fluctuation of our hormones of estrogen and progesterone, and the progesterone seems to decrease more than the estrogen. So here we have what I call the girls, estrogen and progesterone. And so these hormones are somewhat fluctuating, but it ends up where I am seeing in my own clinical experience with the test results where progesterone is much more lower than estrogen. This is causing what's called estrogen dominance, okay? And so the ratio is changing there. And there are different things that can cause this estrogen dominance besides decreased ovulation. There are substances called xenoestrogens in our environment that we are coming more and more in contact with that are affecting our hormones. Xenoestrogens are things like plastics. Xenoestrogens are in cosmetics as well as other things. There are also, it has a higher estrogen effect. There are also things called phytoestrogens, phyto meaning plant. So there are a lot of plant foods that we are eating that are causing an increase in estrogen, causing an estrogen dominance in relation to progesterone. One of the main phytoestrogens for food is soybeans, okay? So soy is in a lot of things. Soy is in protein bars. Soy is in protein shakes and such as this. So I tell people to be very careful of the soy when they are in perimenopause. The other thing is stress. Stress can decrease the amount of progesterone. Also, after women have babies, their progesterone plummets down, and it's called postpartum blues. They feel extra tired, they're kind of moody, somewhat depressed. This is from that ratio of estrogen and progesterone. Estrogen being dominant, progesterone is low. So what does progesterone do? Progesterone is something that is natural to us. We were born with it. It is our natural sedative. It gives us that feel-good feeling. We just have that sense of well-being with enough progesterone on board. The other thing with progesterone is it helps us to get that deep sleep at night where we wake up refreshed and feeling good. So progesterone is a big player for us. And when it's decreased and we have too much of an estrogen dominance going on, we just don't feel good. So that leads us to more of the signs and symptoms. Insomnia we talked about, also hot flashes and night sweats. So we hear about hot flashes and night sweats in menopause from too little estrogen, but too much estrogen can cause the same thing, hot flashes and night sweats, and keep us awake at night. Some other symptoms are weight gain, fluid retention, anxiety, difficult concentrating, memory loss. These are all symptoms of estrogen dominance. So what's happening here is there's a few things happening. One is when you have estrogen dominance, it proliferates tissue. And what I mean by that is the breast tissue can get very dense. You are more prone to having increased cyst on the breast, increased cyst on the ovaries. The uterine wall, the inside of the uterine wall can get very thick, and women can have heavy periods, also PMS symptoms as well. So there's a lot of symptoms there going on. Something else that's very interesting about estrogen dominance and not having enough progesterone, and that is something that we have called functional hypothyroidism. And what that is it's not actually a low thyroid per se, but it is the estrogen dominance is blocking the thyroid molecule from getting out of the blood into the cell to make it work, okay? Let's say here's estrogen, it's blocking, it's a blocker when you have too much estrogen. And here is a thyroid molecule. So this thyroid molecule is in the blood, is inactive. It's trying to get over here at the cellular level, okay, to become active, to give us our energy, okay, and our motivation and our drive, and to keep our weight at a good weight. So here you have the thyroid molecule, and the estrogen dominance is like blocking that. So it appears to be like a thyroid condition, when actually it's not a true thyroid disease per se, but it shows all the symptoms of hypothyroidism. So it's called functional hypothyroidism. And so women come to me and they say, you know, I really need to check my thyroid. I have a lot of signs and symptoms of hypothyroidism. And we do that, we do a thorough check on that. But we also have to keep in mind that this condition during perimenopause, this estrogen dominance, can cause something called functional hypothyroidism that looks like a thyroid disease, but it's really not. So that can be treatable as well.